Welcome. My name is Uttara Bharat Kumar, and I'm going to share with you why social and behavior change approaches are important for improved family planning and reproductive health outcomes. First, let's talk about what SBC is. So, what is social and behavior change, or SBC? It is an intentional process grounded in social and behavior science that seeks to understand and facilitate positive behaviors, social norms, and influence the structural, contextual, and environmental determinants that enhance individual and collective well-being. When there is unmet need for family planning, this may be due to a number of different barriers. They could be, for example, individual, or they could be social or normative. They could be structural or policy related. Let's get into what each of these mean a little bit. If you think about individual level barriers, the attitudes and beliefs of an individual can affect how they consider family planning or take up family planning related services or use family planning methods. What kind of attitudes and beliefs exist that may support or prevent this? Expectations. What do people feel will happen as a result of practicing family planning? Knowledge. Do people know why family planning is important and how to practice it? Self-efficacy. Do people feel confident that they can practice family planning? Skills. Do people have the right set of skills? Threat. How concerned are people about the outcome the behavior will prevent? Right? The next, and these are only a few factors, there are many more factors. If you think about social and gender norms that might exist, when you look at gender norms, are there defined roles and decision-making factors between men and women that could inhibit family planning uptake? If you think about social norms, do people think others in their community or social network practice family planning? Do those people actually practice family planning? And are there informal rules that govern this sort of use of family planning in the group or in the society that people live in? These are important to take into consideration because sometimes this may be the barrier. The third set of factors are structural or policy related. Access and availability, for example. Are there family planning products and services that are required for uptake of family planning available in the clinics nearby? How difficult is it for people to access them? Are these products and services affordable? Or are there financial barriers to practicing family planning? What about the policy? Are there supporting protocols, policies, or laws that promote or inhibit the way family planning is practiced? For example, in some countries, it is not legal to access family planning if you're not married or if you're below 16 years. Quality of care is the last one. Does the provider of a required service for this behavior follow certain quality standards or protocols or guidelines? And does the provider treat the care seeker with respect and empathy? So these are all factors at 3 different levels. These are only a few illustrative factors. There may be a lot more. Can you think of some? SBC can help address most of these factors in some way or another, even if it is advocacy for better structure or policy. SBC is part of the solution, not all of it, but an important part nonetheless. Let's watch this short video together before we go on, shall we?
Social and behavior change, or SBC, is an essential component in achieving countries' family planning commitments and global development goals. SBC interventions use a deep understanding of human and societal behavior to increase adoption of healthy behaviors and influence the social norms that underpin those behaviors. There are 3 key reasons why SBC is an essential component of any family planning program. First, SBC is rooted in global evidence and best practices and shown to increase successful outcomes in family planning. Second, SBC approaches complement service delivery investments. And third, SBC demonstrates a high return on investment in both the short and long term. Let's take a closer look at each one of these. First, global evidence shows that SBC improves family planning outcomes. SBC interventions have been proven to positively impact intermediate outcomes such as approval of family planning and open communication with the partner, and have a direct effect on modern contraceptive use. For example, the Nigerian Urban Reproductive Health Initiative was able to increase modern contraceptive use in one city by 15% by using multiple SBC approaches, including TV, radio, and community engagement. Second, SBC complements service delivery investments. SBC interventions improve health outcomes and enhance efforts along the service delivery continuum before, during, and after a person goes to a health facility. In Rwanda, the Banda Pahero project created a supportive environment before women went to family planning services by holding counseling sessions in the community with women and their male partners. The project resulted in multiple positive health and gender-related outcomes, including an increase in modern contraceptive use, increased support from men for reproductive choices, and improved decision-making power for women. In Indonesia, mass media and community education were used to improve clients' participation in family planning counseling sessions. As a result, more clients prepared questions for their family planning provider prior to their appointments and improved their communication with the providers. Third, SBC demonstrates a high return on investment. Peer-reviewed research has shown that SBC interventions are cost-effective and provide a high return on investment. Data from Zambia and Guinea has shown that every dollar invested in high-quality SBC to improve family planning uptake saves between $2 and $6. Achieving family planning goals is within our reach. When we invest in high-quality SBC interventions, we can amplify our family planning work.
Well, as you can see from the video, the three key reasons why SBC should be included as part of all family planning programs were clearly outlined. We're going to go through them one more time just for a quick recap. The first is that SBC has been shown to increase successful outcomes in family planning based on global evidence and best practices. It's been proven to positively impact all the intermediate outcomes like approval of family planning, open communication with a partner. These are all factors that increase the likelihood and have a direct effect on modern contraceptive uptake. There is no ideal family planning outcome without SBC. Social and behavior change objectives contribute to the overall national family planning objectives. They amplify the efforts of service delivery and policy to increase family planning uptake. The second, as you saw, was that SBC approaches complement service delivery investments. SBC includes a range of approaches that can and should be applied across family planning programming, not just demand. Investing in SBC increases effectiveness of clinical investments and services. SBC is not just a standalone, but it's informed by local needs and often developed with community collaboration. In fact, it should be developed with community collaboration. SBC is necessary for achieving country priorities. SBC can be used across the service delivery continuum, if you remember the circle from the video, to get clients to the services, improve the experience that they have and the quality of the care they receive when they're at the services, support informed choice, whether they're using a family planning method or thinking about it, facilitate adoption and maintenance of behaviors. None of this is possible without individual behavior change and supportive norms and structures. The third is that SBC demonstrates a high return on investment in both the short and the long term. Every dollar invested in high-quality SBC to improve family planning uptake can save between $2 to $6 for your country. And this is true when you have well-designed SVC programs that are highly cost-effective. Both short-term and long-term results are reached and measured with effective evaluation. However, SBC is often misunderstood, narrowly implemented, and even deprioritized. Oftentimes, it is seen as a spare wheel. SBC is usually tacked on last to largely clinical service delivery investments, and if there's a funding cut or a budget cut, usually it's SBC that gets cut first. A program claims sometimes that SBC was done when it was just a poster or a leaflet or a one-way lecture. Often even those are not strategically developed or evaluated for effectiveness. So to achieve better family planning and health outcomes, a greater investment in quality strategic SBC is needed. And SBC should be the steering wheel, not the spare wheel. And tracking implementation of SBC for family planning and reproductive health activities and evaluating their effectiveness is critical in proving that it works. Remember, a steering wheel and not a spare wheel. When you think of SBC interventions, what immediately comes to mind? What immediately comes to mind? You might think a poster or a leaflet or a radio program perhaps, but if you think about it, quality SBC that is strategically developed has to be evidence and theory informed. It should require formative research. It should address facilitators and barriers, individual behavior as well as social and gender norms, to practice target behaviors with the ultimate goal of creating the sustainable behavior change, not just one time. It needs to be context specific. And by that we mean the country, the culture, the local norms, etc., that makes it appropriate and relatable. And it also needs to be audience-centered in the way that it's developed, the way that the solutions are generated, and the way it is implemented. It needs to be developed through meaningful partnerships with communities and address their perceived needs, not what we think they need, but what communities feel they need, and developing them with meaningful partnerships, not tokenism. They can and should be monitored regularly and evaluated consistently. And it requires close collaboration and coordination with policy and service delivery mechanisms, because SBC is not outside of what is the local priority, but is within and contributes to. SBC is both an art and science. We have to work with the right information and evidence, no doubt, but we also have to be able to convey that creatively to the right audience segment. It's not just enough to invest in SBC, but we also need to do it well and measure it and know whether or not it worked. In any context, SBC can be most effective if the environment has some key competencies. And there needs to be coordination between the governments and partners doing SBC, a strategic direction that's clear, harmonized approaches to health challenges, and a breadth of competencies, including technical expertise in various areas, leadership, management, financial systems, and so on. Really, once we have that in place, how can we ensure we use the power of SBC? We need to recognize the importance of SBC and know where it can fit in your programs. If you don't have staff with adequate if you don't have staff with adequate SBC technical expertise to best use SBC to address different family planning goals, you need to find the right experts to engage. Within the ecosystem, there are people with specific expertise that you can tap into. Like any other profession, SBC requires specific skills. You need to factor in monitoring and evaluation to see quick results that link SBC programming to concrete outcomes. We also need to make sure that SBC is included in national family planning and reproductive health strategies and plans, as they are the most essential component of family planning and reproductive health programs. Most important, we need to allocate resources to SBC programming. When you want quality, it requires resources for the right level of effort. Thank you very much. We hope that you enjoy this journey, making meaningful use of social and behavior change approaches to enhance and amplify the results of your family planning and reproductive health programs. Thank you.